frontline vehicle contains PPE. Universal Standard Precautions or Level 1 PPE is in this red pouch. These are in every response bag. They contain safety specs, 2 pairs of sleeve protectors, 2 aprons, 2 FFP3 masks, 2 surgical masks, and a clinical waste bag. This means for any infection where there is a risk of body fluid or infectious contamination, everyone has access to these items immediately from the response bag. Every frontline vehicle also carries this green and yellow bag called the PPE Infectious Pack. This pack contains both Level 1 and 2 PPE. These packs contain 2 pairs of boot covers, 3 Tyvek suits, 2 pairs of heavy-duty gloves, 2 safety spectacles. Then, in the other side, there is a box. And this box contains 2 FFP3, 2 surgical masks, 4 aprons, 2 pairs of sleeve protectors, 4 pairs of shoe covers, 4 hair covers, and some clinical waste and laundry bags with ties. Also, 4 surgical masks with visor. This means that there are 3 types of mask, 4 of each type on every vehicle: surgical without visor, surgical with visor, and FFP3s. The principles of fitting any mask are very similar, with the metal strip going over the nose to create a fit. Then the straps go, top ones over the top of the ears, the bottom ones under the ears. Every mask also has to be fully open before putting it on to be effective and fit correctly. Ensure that the metal strip is tight into your nose. Then tie the top strap above your ears, followed by the bottom strap below your ears to ensure a good fit. For an FFP3, open up fully, place metal strip on your nose and elastic straps over your head. Arrange the straps, bottom one below your ears, the top one above your ears. Ensure the mask is still fully open and that the metal strip is tight against your nose. Then do a fit check. Place your hands around the sides of the mask, take a deep breath in, then blow out. There should only be air coming from the center of the mask, no leakages around the edges. Also, on every vehicle, there is an information pack regarding the actions to take for viral hemorrhagic fever patients. These action cards have the information on the application and removal of PPE. If you find you require Level 2 PPE, for instance, if you're sent to a suspected Ebola patient who is in the second level of risk, go to Action Cards 2, which give information on any viral hemorrhagic fever suspected patients regarding vehicle preparation, crew actions, PPE removal, vehicle cleaning, and officer on-scene actions. To apply Level 2 PPE, the following process should be followed. The water repellent overall is easier to put on if you find somewhere to sit. Remember to remove all items from your pockets, such as mobile telephones, and remove any wrist or fob watch before you put these on. The first things to put on are the boot covers, as these need to be underneath the overall. Put the boots on. fixing the Velcro strap around your ankle. Then put the overall over your feet and stand up. Pull the overall up to your waist and put your arms in. Then bring up to your shoulders. Do not put the hood on yet, pull up the zip. Next, put on an apron. If the neck of the apron is low, this can be knotted at the back of your neck to bring it up tight under your chin. And knot the waist ties. Then, if you need to wear an FFP3 mask, this goes on now, before you put up the hood of the overall. Safety spectacles or goggles can be worn at this point also if required. Pull the hood up, ensuring all of your hair is tucked in. If you have loose hair, then you may require a hairnet to hold your hair under the hood. You may need someone to help you at this point to ensure all your hair is covered and inside the net. A surgical mask with visor can now be applied to help to protect the majority of your face. This can be worn over the top of the hood. Then it can be changed easily if it gets soiled. Gloves can now be worn. If double gloving, put the first pair under the sleeve, the second pair over the top of the sleeve. If you feel you need to wear sleeve protectors as well, these can be worn now. Remember, if you are wearing PPE, you are wearing it for a reason. Do not touch or scratch your face or any exposed skin once you have been in contact with the patient, as this could spread the disease to yourself. If you are wearing 2 pairs of gloves, remember the importance of changing a top pair on a regular basis to prevent cross-contamination. Firstly, pinch the top glove on one hand on the wrist by the thumb. Pull the glove up and over the thumb, exposing the inside of the glove, which is clean. Use the clean thumb to turn the other glove inside out. Then use the other clean thumb to remove the first glove, incorporating the other inside-out glove, and dispose of them both as clinical waste. You can now put on a clean top pair. For Ebola and other VHFs, the mode of spread is the blood and body fluid. If a patient who is a high risk of Ebola is losing blood and body fluid, this moves the patient into the next level of risk, so inform control that heart are required for the transport. Heart have a designated Category 4 transfer vehicle which can be deployed if required. This vehicle is prepared ready to transport a Category 4 transfer. Specialist PPE boxes are kitted ready to be deployed at each hub. They are also carried by on-call NILOs. In these boxes there are spare items for Level 1 and Level 2 patients, plus specific special items such as waterproof overalls, goggles, bags for equipment and staff belongings, roll of tape for temporary repairs, cleaning items, and also a white body bag and large stretcher-size absorbent sheet, which can be used like this. Put the body bag on the stretcher. Undo zip. Place the stretcher-size absorbent sheet inside the bag. tucking it in. And then ask the patient to sit inside and zip partway round to use as a sleeping bag. This will protect and hold in a large amount of body fluid loss. PPE has to be removed carefully to ensure no cross-contamination takes place. This can be done by the person wearing it. However, it's much easier for someone to help with this to ensure the undressing is safe. The safe undresser needs to wear level 1 PPE if helping to remove level 2 PPE. Remember, this could be required at the scene of an incident, at the hospital, inside or outside. Hand hygiene is very important in this process to ensure you do not contaminate yourself or the environment around you. You may have access to soap and water, you might have to use wipes and alcohol gel, or change your gloves at each high-risk part of the undressing process by following double gloving process. First, set the scene. Place large yellow clinical waste bags, one to collect some of the PPE in, another for the person undressing to stand in. Ensure the hand hygiene method required is nearby, either a sink, soap and paper towels, or alcohol gel, wipes, and the correct sized gloves. Remove the apron. If this is badly contaminated, the contamination can be wiped off using the wipes to prevent any splashes on removal. Break the top ties and fold down. Then break the waist ties and fold into the middle, only touching the inside of the apron. Dispose of in waste bag. Decontaminate your hands. Remove the surgical mask with visor if one has been worn over the top of the overall hood. Undo or break the bottom tie first, then lean forwards. Undo or break the top tie and drop the mask away from your face into the waste bag. Decontaminate your hands. To remove the overall, use of a safe undressing assistant is the easiest way for this to be done. First, take off the hood, turning it inside out. Decontaminate hands. Then undo zip. Decontaminate hands. Take the overall off the shoulders and start to remove, touching the inside of the overall only. Turn the overall inside out and roll it up at the same time. Remember hand hygiene at any time you or the safe undresser believes their hands are contaminated. Your gloves could come off at any time during the process. If this happens, either follow the double glove process or decontaminate your hands and put on clean gloves. The safe undresser can continue rolling the overalls down to the boots. Break the straps on the boots. Continue to roll the overall and boots over the back and top of the wearer's boots. Then ask them to carefully lift their right foot out of the suit and step forward with that foot, and repeat with the left foot. The overalls and boots then go into the clinical waste bag. Decontaminate hands. Any PPE items that are on your face and head, such as a hairnet and safety spectacles, can now be removed, with the face mask removed last. If gloves are still on, these can be removed now and hands thoroughly washed and dried. The safe undresser can then remove their PPE, apron first, followed by sleeve protectors, top gloves, and then mask and bottom gloves.